This year's theme for the World Cancer Day is anchored on creating awareness collectively or individually on what one can do to reduce the global burden of cancer. In Uganda, the scourge of cancer continues to peril lives. And according to the Kampala Data Registry, by 2017, we had an excess of 200,000 cases, both new and old, including those that have been treated and cured. Most of those found with the disease die a slow and agonizing death. However, Gertrude Nachigude overcame breast cancer. She says early diagnosis helps to overcome the disease.
16 years ago, I had a lump in the breast, but I didn't know what it was.
Cancer, a non-communicable disease, can be treated and is curable if detected early. However, the symptoms are painless.
I didn't take a lot of concern about it because it wasn't painful, it was small, and I kept that swelling for 1 year. But that swelling kept growing bigger and bigger. So one time I felt a slight pain, but it was so instant. When I went to see a surgeon, the surgeon told me it's innocent, but you can remove it. So I had the lump removed, and to me it was removing that something that has always been there. I never thought it would be cancer. And everywhere I went, they say, if it's cancer, yeah, the solution is to have your breast off. That was another nail hitting into my flesh.
However, Nachigude says there is a lot of stigma surrounding cancer, which is one of the reasons that some people choose to wait for fate.
And it really took me a lot of time to cope, to get used to my sight. I would look at myself in a mirror and cry. One time even I told my surgeon, maybe I remove even this one because I looked disfigured. A lot of patients up to today don't even continue with the treatment because they don't take decisions the right way because they don't have enough information. For example, as I said, to accept to have your body part, your breast off, that's a major decision that you would really take. To decide that let me have my leg off because that will save me. A lot of women are still even dying today because they can't imagine living without a breast.
Uganda Cancer Institute registers between 4,500 to 6,000 new cancer cases every year. But there is low access to medication at the Cancer Institute. For every 100 suspected cancer cases, only 4% make it to Uganda Cancer Institute, while 96% do not access care. To mark today's event, various partners including the Health Ministry and Parliament participated in events to raise awareness. While speaking at Parliament, the Health Minister requested for more support, especially in detection of cancer.
We need to know exactly the types of cancers we have in this country, their magnitude, and we need to find ways of reaching out to the people with correct information.
Dr. Cheng also said the ministry is working to procure more modern equipment to help in diagnosis.
Already we have started bringing in a few equipment, but moving forward we shall put emphasis on ensuring that diagnostic equipments are available in the country for us to be able to be diagnosed and get the treatment when it is necessary. Because there are so many unnecessary referrals that can actually be handled from here, but we refer them and then we meet Ugandan doctors on the other side to treat them.
There is a risk in our population related to lifestyle choices, such as consumption of tobacco and alcohol. These have direct links to cancer-causing agents. Some of the commonest cancers here include cervical cancer, breast cancer, prostate cancer, cancer of the liver, among others. The Speaker of Parliament, Rebecca Kadaga, tasked the Health Minister to do more in the fight against cancer. But she also pledged support from Parliament.
You can take it for granted that Parliament supports you, and we shall work with you wherever you need us.
Your chances of developing cancer are affected by the lifestyle choices you make, and thus simple lifestyle changes can make a big difference. Do not use tobacco, eat a healthy diet, maintain a healthy weight, and be physically active. If you choose to drink alcohol, do so only in moderation. Limit processed meats and go for regular screening to know your status for early detection and intervention. Walter Mwesije, NTV.